I'm Dr. Jonathan Sheldon with the Sheldon Sowell Center for Health. I'm a board-certified family physician and geriatrician. My first career was in rock and roll. I played rock and roll in New York City and Portland a little bit and in San Francisco. And when I decided to go back to the University of Colorado and finish my undergraduate degree, I was taking a course in medical anthropology. All of a sudden a light went on and I just thought, this is really interesting, number one. And number two, if I became a medical anthropologist, I would be doing research in the hope that some doctor would read it and do what I said. And that led to the realization or the decision that I'd rather be the guy who got to decide what got done. So I applied to medical school, and I was fortunate to get into medical school here at the University of Colorado, and that was the beginning of my medical journey. You know, in Buddhism there's a principle of right livelihood. There's an idea that your work ideally should contribute to the comfort and peace of the world, and medicine met that for me, met that need for me, and of course was intellectually stimulating. I had some friends who were practicing up in Gunnison County, in Crested Butte and Gunnison, and they had such a love for their work, it really turned me on to medicine, and they were family docs. So they saw everything that came through the door, and so my ideal always in medicine was a family doctor, because I couldn't find one part of medicine that was more interesting than the other parts. And so the beauty of family medicine to me is, number one, you never know what you're going to see, and number two, if it's ophthalmology, you get to learn some ophthalmology, you get to learn some surgery. So that's always my goal in family medicine, to be a family doc. The thing I love about family medicine is, of course, the relationship with patients and with their families. And so we have the time and the training to really get to know people. And of course, in our particular kind of practice, we have a lot of time and the ability to really delve deeply, which I think makes a real impact on people's health. My philosophy of patient care is very simple. I treat people the way I want my own family to be treated. Period. End of story.